Welcome, everyone, to our webinar meeting tonight on the Introduction to Veterinary Homeopathy. We are the Pitcairn Institute of Veterinary Homeopathy. We've been training veterinarians in classical homeopathy since 1992. I'm Sarah Stieg. I am the director of the program. So I will be lecturing with you tonight along with faculty member Dr. Andrea Tassi. So I'd just like to start by telling you a little bit about myself. Like most of you, I wanted to be a veterinarian since I was 4 years old, but I have a rather unusual journey as I started studying homeopathy long before I entered veterinary school. So I actually entered veterinary school with the intention of becoming a veterinary homeopath. I took the then called professional course in veterinary homeopathy during my senior year of veterinary school, being the first veterinary student to ever take the program, and then entered homeopathic practice as soon as I graduated. I currently have a mobile small animal equine mixed practice in North Yorkshire, England. It's a practice that's 100% classical homeopathy and clinical nutrition, and I act as a primary care provider to all of my clients. So I'm going to pass over to Dr. Tassi, and Andrea, why don't you go ahead and share a little bit about yourself before we get started?
Hi, everybody. Welcome, and thanks for joining us. I'm a 1988 graduate of University of Pennsylvania, and I have been in feline-only practice since 1991. My current practice is here in Northern Virginia, sort of just outside of Washington, D.C., and I have a house call, cats-only practice, which is pretty much all homeopathic. There's a few little odds and ends of conventional care, but my goal is to deliver homeopathic care as a primary care provider for all of my patients. I came to homeopathy later in the game than Sarah. I'd been in practice almost 20 years before a sort of frustration with, despite practicing to the best of my pretty academically rigorous way of doing things, I could make symptoms go away in my patients, but my patients wouldn't get healthier. I was chasing drug side effects, or as soon as I'd made one problem go away, something else came up. And I got some good advice from a local holistic practitioner that I ought to look into homeopathy because it was so cat friendly. And indeed, when I read a book on homeopathy, it made sense of everything that I'd been seeing for many years. And so I took the original courses with Dr. Pitcairn back between 2006 and 2008. Those courses have been combined into our current master class. So you get the benefit of everything in one extended class where I had to divide it up into two. And I've just never looked back, and it's just changed my life for the better. And it's a wonderful thing. And I'm very excited to be able to share a little introduction to this very powerful, but very gentle healing modality.
So between the two of us, you have over 45 years of combined clinical experience to share with you tonight. So to start, we're just going to go over the goals of our presentation for you. So now this is an introductory webinar. So first, we're going to start off with comparing allopathic to homeopathic approach to disease. We're going to review the role of the vital force in the law of similars, discuss the origins of homeopathy to contextualize its development for you. We're going to discuss applications in veterinary practice, including acute versus chronic disease treatment and the differences in how we approach that in the course. And then we're going to bring it all to life by going through some very exciting case presentations. And then discuss with you about what's involved in homeopathic training, certification, and continuing education. And then give you a recommended reading list that you can start with right now and some helpful resources. All right, Andrea, will you go ahead and we'll begin.
Okay. All right. So I think if we're going to talk about homeopathy, I think we need to first understand the principles that are different in conventional medicine, which we'll refer to as allopathic medicine. A main principle of allopathy, stated in Latin, is contraria, contraris curantur. This was Hippocrates, who said that things could be cured by opposites. opposite sort of therapies. And we'll discuss that a little bit more. But the allopathic or conventional medical model that any of us who've had any conventional medical training have been grounded in this is a physically based system. This assumes that when we're looking at a dog, a cat, a human, we're looking at the physical organism as the primary reality, the physical matter that the organism is made up of. And in this model, disease is considered some alteration or dysfunction of the functions of those physical parts of the body or the structure of those physical parts of the body. Those physical changes are what create symptoms. And in that allopathic medical model, the goal is to try to make those symptoms go away by sort of counteracting them or blocking their expression on a physical level. And so the foundation of all this is referred to as scientific materialism. In other words, the material world. I said this is the most orthodox and common cultural model too for most how everything works in most Western society. And in this model, it said all of reality comes from this material foundation. We'll go to the next slide. In this allopathic conventional approach to disease, there's a sort of structure that's followed. And usually, when you're approached with a sick patient, the first goal when you're doing this type of medicine is to give this patient a diagnosis. What named category of disease does this patient have? And so a cat might be told, oh, well, this cat has renal disease or kidney disease. This patient has hyperthyroidism. This patient has Cushing's disease. And once you have your named diagnostic category of disease, there is a certain degree of ease and cookbookness to then treating the patient because there is a prescribed regimen of drugs or other therapies for any given named disease. And when we're talking about drugs, which are used to try to quiet down or make things go away, make symptoms go away, to suppress symptoms, it's even in the names of most drugs that we are working with sort of an opposite kind of strategy, because so many of our drugs, actually the first part of their name, it starts out with anti. So there are antibiotics for bacterial infections, antivirals for viral infections, anti-inflammatories for inflammation or swelling, antiemetics for nausea and vomiting, immunosuppressants for autoimmune disease. The goal of all these drugs being to sort of quash down the symptoms, because that's our definition of then trying to make the patient well. Any of us who've practiced any form of medicine know that especially in treating any patient with a chronic disease, in this model, there is frequent repetition of the medicine that is needed. You are needing to keep giving the patient medication, because if you stop, typically these symptoms will return in any chronic condition. And anybody who has prescribed drugs to patients over time will see that many patients will have side effects, that there will be undesirable effects, in fact, sometimes even new diseases that arise from the drugs that are given to the patient. Next. So let's now contrast that with how homeopathy approaches health and disease and looks at things in a very, very different way. Instead of scientific materialism, meaning sort of what you see is what you get in terms of the physical world, homeopathy falls under the vitalist model. Some folks will also use the term dynamism. And homeopathy says that there is more than meets the eye, that in the physical world, the disease has an origin that is before the physical, because life itself has an energetic essence that is prior to the physical form. And in homeopathy, we tend to call this the life force or the vital force, and we're going to get a little bit more into that. But this energetic essence, the vital force, this is responsible for sort of why any of us are here in the first place, because the vital force is what brings into existence the form of any living being, from a microbe to a plant to any kind of animal or human. And with every living thing sort of having this vital force fundamental to them, homeopathy says that illness is not something that occurs at the physical level. It occurs at this energetic level when the vital force is distorted or mistuned. And that the symptoms we see in the sick patient are a result of this energetic mistunement. The symptoms are not the disease itself, but the expression of the disease from the mistunement of the vital force. Again, because disease exists at a plane more fundamental prior to the physical level. Next. So, what is the vital force? So, I think any of you who have studied Chinese medicine would recognize that we're talking about what is referred to as qi in traditional Chinese medicine. And other alternative complementary forms of medicine tend to have some acknowledgement of this energetic potential, this energetic essence in living things. Sort of conventional medicine is the one thing that kind of leaves that out. But the vital force creates balance and normal function. It allows for homeostasis. It controls everything in the body. It's the energy that allows any organism to grow and develop into what it should, and when mature, to sort of maintain that organism in optimal health. When the vital force is mistuned or affected by some adverse event or what we call a morbific influence, something that influences it in a negative way, its defensive response to this is to create symptoms. And the vital force in making these symptoms is doing its best job possible, the best it can do, to try to eject, to free itself of this disease influence and try to get back to normal, healthy functioning. So we as homeopaths look at symptoms as the language of the vital force and use the symptoms that the patient is exhibiting and what we call the totality of the symptoms, sort of the full artist's palette of the symptoms the patient is exhibiting, to choose the one homeopathic medicine that matches those to release the vital force to return to normal function. Because the whole principle of homeopathic medicine is that whatever we're doing, we are employing the vital force in an effort to heal itself. Next. And we do this with a very different principle from allopathy. And our little Latin line for homeopathy here is similia similibus curantur. And this is the line that many of us who have, maybe just a little bit of familiarity with homeopathy have heard this referred to as the law of similars, or let like be cured by like. And this was discovered by Dr. Hahnemann, Samuel Hahnemann, who we'll discuss a little bit further. Basically, he discovered that any medicine that can produce symptoms in a healthy patient, symptoms of a disease type, a morbid symptom, that this substance can then remove these similar symptoms that are occurring in an ill patient as an expression of their disease. And that when we're choosing these remedies, we are choosing them for the patient based on their symptom, not based on a named category of disease, like our sort of cookbook method that we use in conventional or allopathic medicine. And a simple example here would be, in a given month, I might see 3 different cats who would each fall into the conventional diagnostic category of cystitis, meaning inflammation of the bladder. So these 3 cats, all have the symptoms in common of some bloody urine, going back and forth to the litter box frequently, just peeing a little bit. But because I am a homeopath and I am prescribing for the patient, not for the named disease, each of these cats might actually get a different homeopathic prescription because one kitty might be quite clingy and thirstless and deciding to hang out by the draft by the window, whereas another kitty with the bloody urine and those same sort of traditional symptoms might be sort of grumpy and standoffish and chilly and sitting on the heating pad and quite thirsty. You can see in homeopathy, those 2 patients are very different. They have in common the symptoms that are common to this diagnostic label. But me as a homeopath, I'm going to be trying to individualize my patient and not just treat for cystitis. In fact, when many of my colleagues will call me and say, Andrea, what do you use to treat cystitis? And I will say, I don't treat cystitis. I treat cats who might have a cystitis-like condition. Always individualizing to the patient and not the diagnosis. Next. So let's give a very brief little homeopathic case example that comes from an old master of homeopathy, Dr. Guernsey, MD, a homeopathic physician, and he wrote up this tiny little case in January of 1880. And so the words here we're using are his words. He says, a few years ago, whilst driving from house to house to visit my patients, I was detained at one place longer than usual when my coachman sent in to tell me that one of the horses was taken suddenly ill. Because, of course, in 1880, driving would have meant a horse-drawn carriage. So we were probably a carriage drawn by 2 horses here. Dr. Guernsey then goes on to say, on going out to see what was the matter, the mare was lying flat on her belly and suffering with a severe attack of colic. Next. He said that this mare was of a mild and gentle disposition, refused water, and she was covered with a cold sweat, although it was a warm summer day. Dr. Guernsey, the homeopath, looked at this horse and said, I know she has colic, but what is unique about this horse with colic? So he looks at her and says, from the fact that she was lying so flat upon the abdomen, I interpreted that she must have felt some relief from pressure. He also took into account her mild and gentle disposition, her lack of thirst, and this cold sweat all over. And as the highly trained homeopath that he was, he saw immediately, he recognized in this pattern of symptoms the remedy, the homeopathic remedy pulsatilla, which is made from a plant, the windflower. And so he administered the horse 1 dose of pulsatilla in a 200C potency. That was just given some pellets upon her tongue. And what happened? Well, in less than half an hour, this severely colicking horse, she rose, shook herself, and there was no more trouble. And not only was she able to get up from this extremely severe colic, this horse was then able, she said, I drove her back to the stable. So the horse had to be reattached to the carriage, pull the carriage home, so exert herself. And yet she did fine with this and just rested overnight, did not take her out until the next morning, but she was well. And I think any of you who've had any experience with horse colics would say this is a very impressive thing to see someone down with such pain up and able to even work again in half an hour and be well. That's a remarkable thing. Next. So let's talk a little bit about our founding father, Dr. Samuel Hahnemann. I could probably talk for 2 or 3 hours just about Hahnemann, but I'm not allowed to do that. But he was a fascinating, fascinating man. The picture on this slide is a statue of Hahnemann that is here in Washington, D.C. I've been to visit it. Anytime I do a house call in D.C., I go and say hi to Samuel. It's a beautiful monument, and it was erected because of so much help that was given by homeopathy in certain disease epidemics here in the United States. And so it's a beautiful, beautiful statue. Dr. Hahnemann is really the founding father of homeopathy. He was a German physician, also trained as a chemist. He lived from 1755 to 1843. He was a remarkable man, tenacious, brilliant, thoughtful, so intelligent. He spoke 7 languages. He trained, as I said, as a physician, but when he went out into practice, he became rapidly disenchanted with what he considered to be barbaric and unkind methods that were used in medicine, to the degree it just offended his conscience so much that he said, I can't do this. I think physicians are doing more harm than good. He was also quite troubled by how the practice of medicine was mostly about speculation and opinion, that there was not sort of a grounding in evidence or observation. His mind was so scientific, he really, at that point in time, medicine was not a scientific field. And Hahnemann had such a scientific mind, it very much troubled him. So he stopped practicing medicine, and to support his family, he did translations of scientific books, especially. He would only sleep every other night, and he'd stay up all night doing translations. And in 1789, he had the job of translating a book that had part of its text dedicated to discussing the use of Peruvian bark, also known as cinchona, for treatment of malaria. And this book said, well, the reason this drug or this herb works for malaria is because it is very bitter. It has very astringent properties. Of course, Hahnemann could not just translate that. He had to think about it. He said, wait a minute, this doesn't make sense to me. There are other more bitter roots out there with more astringent properties, and yet they don't effectively treat malaria. And in thinking upon this, of course, with his experimental mind and wanting to find observations and evidence, he decided to conduct an experiment on himself, and he made a tea of the cinchona bark and took repeated doses of this tea to find out what would happen. And lo and behold, in doing this, he developed malaria-like symptoms. And then he said, oh, wait a minute, probably, here's my theory, and I'm going to put this in a footnote here, that the bark is curative because if it can cause these same symptoms in someone who is well, he was well when he took this tea and developed these symptoms, that is why it can cure these symptoms in the ill. So this is the fundamental principle of the like cures like. A great mind. Next. A lovely thing about homeopathy and the way, the system that Hahnemann developed, one of the most important things is just as he felt so bad about the barbaric, harmful, painful practices that were done in medicine, he felt that true healing should be gentle and kind. And in respecting the body's innate ability to heal and using the body's own vital force, homeopathy is just that. And to understand what the patient needs, what remedy the patient needs, we simply need to look at the symptoms. because those are the expressions of that individual patient. And once we understand those symptoms, and if we know the symptoms of our homeopathic medicines, we can then use those symptoms as a guide to our most similar remedy. And when that remedy is given and acts curatively, the symptoms simply disappear because the vital force can, through the action of the medicine, simply free itself of the disease influence. And in many instances, one treatment, in other words, one remedy, can restore the condition of health permanently. And it is an important point here when we're talking about classical or Hahnemannian philosophy and treatment. We are always talking about treatment with one medicine at a time, one homeopathic medicine at a time. This is a very fundamental rule that Hahnemann laid out. And when a patient is successfully treated, curative homeopathic treatment results in improvement of the entire patient, not just one symptom. So this is not like my patients who, when I was treating a cat for inflammatory bowel disease, I could absolutely shut their vomiting off like a light switch with a course of prednisolone. Great, I made the vomiting go away. Was my patient better for that? No, the vomiting was simply gone. And so the improvement of the entire patient is always the goal of homeopathy. Next. So how can we apply this in veterinary homeopathy? And really, it's quite across the board because homeopathy is useful in every type of disease: acute illness, infectious disease, injuries, trauma, and also in chronic disease, which is generally considered to be sort of incurable in the conventional world. And we don't need different systems or different pharmacies for different species because the homeopathic remedies and the principles of homeopathy are applicable for all species. Small animals, pocket pets, birds, exotics, wildlife, horses, livestock, herd health, just across the board. And it's really quite lovely that homeopathic remedies themselves are extremely inexpensive, especially these days compared to drug prices. And there are no withdrawal times and there are no physical drug-like side effects when we're using homeopathic remedies. Next. So our goal as a homeopath is to sort of find the one remedy. What is the one remedy that matches the symptoms that we see in our sick patient, that in the information we know about that remedy can produce the same symptoms in a healthy patient. And just as an aside, where did this information come from about homeopathic remedies? There were many sources available to sort of understand basic actions of herbs because herbal medicines had been used across the board. There was information out there about people who'd been accidentally poisoned or exposed by poisonous substances because we use some of these things as homeopathic remedies, things that are considered toxic in the physical realm, but quite healing in the energetic realm. But ultimately, again, it's always to find the one remedy at a time that suits the symptoms in total of our sick patient. And we do refer to that one best remedy. We call that the simillimum. In other words, the most similar remedy for our patient's symptoms. How do we find that? Well, let's move on to our next slide. And as a homeopath, what we do is we have to do a skillful case evaluation. We have to look at our patient and we have to first identify our symptoms as either are we dealing with an acute issue or a chronic issue, acute or chronic disease. And I'd like to take a moment here to say that this is really, really important in training to become a homeopath, to be well versed in understanding the differences in treating acute and chronic disease. And it is part of our program to really give you quite good grounding in this, because having this grounding and understanding the difference really will help you to be successful in your casework. It has bearing on remedy selection, and it also has bearing on how frequently you might have to repeat the remedy over time. When we're prescribing on acute illness, it's generally a fairly simple process of looking at what is in front of you in, say, the colic horse, a very simple sort of, all right, I've got a horse with a bad tummy ache who doesn't want any water and is lying down. You know, what remedy can, and had a cold sweat, what remedy fits that picture? And in these acute illnesses, just as we saw in that colic case, you can see responses that seem almost biologically impossible, and yet are possible when we're working at the energetic level. We can see an incredibly rapid improvement of all symptoms in acute illness. When we're prescribing on chronic disease, the case analysis can be a bit different. It has to be different. You are looking not only at where the patient is now in terms of their symptom picture, but also looking back through their lifetime as much as you can to understand what has been the pattern of symptoms, the trajectory of changes in their health over time, to really determine the totality of symptoms, historical and current. And that's very, very important to understand. And in our chronic cases, what we're going to see typically is just a more gradual return to health. Yes, it's going to take more time, but these patients have generally been ill for a period of time. And when a patient has been ill for a while, it takes the body longer to heal, sometimes to reverse tissue changes. But even in those cases that may take a longer amount of time, it's remarkable the degree of improvement of well-being that you can see in the patient, even early in treatment, that the patient simply feels better in and of themselves. That's often your best indication that you are on the right track as you're sort of launching your patient into the journey of healing from chronic disease. Let's do some examples. Let's go to, in terms of acute situations, anybody in veterinary practice, first-line veterinary practice, sees all kinds of acute things. Any sort of trauma or shock or wound, a scratch to the cornea. Two kitties got in a fight and one cat scratched the other's eye, and now we've got a corneal injury. Anybody who's doing surgery, we have to remember anybody who is in a post-operative state is trying to heal from a wound or an injury that we've had to do for surgical reasons. And treating these patients can provide very effective analgesia and support for healing. Gastroenteritis, that's sort of a bread and butter of many veterinary practices, all the upset tummies. Remarkable how well it can respond to homeopathy. Colds, upper respiratory illnesses, colics in horses, just a few of many examples of what we see sort of on the front lines in regular practice. You can wield homeopathy quite powerfully for all these situations. And one of the nice things, especially in something as serious as colic, if you get a call from your client and you've got a sick, dangerously colicking horse, if your client has an emergency remedy kit at home, you can make a recommendation for a remedy that can be given while you're hopping in your truck to drive over there. So you can begin treatment without you even being there. And often that can just speed things up for the patient. We try to encourage our clients to have sort of home emergency kits just for that reason, because it is so simple for an owner with our instruction to dose a patient quite effectively at home while they're waiting for us to get there, or to get the animal to us.
Yes, and that's profoundly important, especially in wounds and injuries, because they can
Yeah.
start treating as soon as the injury happens. And I can't tell you what a difference in healing time that makes when the client can start treating right away. So it's something I ask all of my clients to do, is to have a home emergency kit.
Yeah, and when we talk about supporting healing, it's not only supporting healing, but also quite actively fighting infection, better than an antibiotic can, because when we are activating the vital force, part of the vital force's toolbox is the physical immune system. And so the vital force, can manifest its stronger response to the immune system. I love what I once heard somebody say. It was actually my mother's podiatrist said to me. He said, "Antibiotics don't heal wounds. Your body heals the wounds," and that's just something very important to remember. It is always the body itself that does the healing, and in homeopathy, we're supporting it at that most fundamental level of the vital force. Sarah, I think we switch to you now.
Yes, so how we address this and approach this in the course is, in order to teach you the fundamental tools of case taking and understanding homeopathic theory, we start with simple acute disease. So in our course modules, the first two course modules, 1 and 2, we'll begin with simple acute casework, where we'll teach you to learn to recognize the remedies and their keynotes. And keynotes are a striking singular symptom that will often point you distinctly to a remedy. Many of you in this room probably already have some basic emergency homeopathic knowledge, such as arnica for trauma or belladonna for heat strokes. And that knowledge can be life-saving in moments of emergencies and acute illness. So, we'll start with some basic things like, as Andrea already mentioned, arnica for shock, trauma, postoperative analgesia. That was one of the things that convinced me to truly become a homeopath was, I had already been studying homeopathy, but when I was getting my small animal clinical experience for veterinary school, because I was primary equine, I was actually the head surgery tech in a small animal clinic that only used homeopathy to recover their surgical patients. And I can't tell you, there's nothing that convinces you faster that homeopathy is real and profound medicine than recovering animals from surgery, where there is no placebo effect for helping them recover and control their pain. Calendula is another important acute remedy we'll go over in this part of the course, that's phenomenal for stimulating wound healing, reducing scar tissue, and especially helpful for promoting wounds to heal by second intention healing, especially for wounds that you can't surgically close. Another useful tip for calendula is in those, naughty doggies that get too active after their surgery and pull their surgery incisions, and then you end up with secondary suture reactions that are, suspicious of going infected. Calendula will settle that right down. Also, remedies such as Nux vomica, Arsenicum album, Pulsatilla, Cinchona for gastrointestinal disorders. And so we'll go over how to work up a case, use the repertory, and learn to create a symptom analysis. And for those of you that are not familiar with the term repertory, a repertory is a book that organizes symptoms and then the corresponding group of remedies that are indicated for those symptoms that have been discovered and during homeopathic provings. We'll also go over how to select potency and treatment and management schedules. All right,
Okay.
Andrea?
Yeah. So then the more sort of challenging side things, but very important, because this is really the biggest part of most veterinary practice, or at least in my world it is the treatment of chronic disease. And in terms of understanding what chronic disease is, homeopathy does not use a time definition for acute and chronic, the way conventional medicine will often say if something has persisted more than this many weeks, then by definition it's chronic. Chronic disease, the way we look at it, is it's a disease for which there is no predicted endpoint. Acute diseases have a predicted endpoint. You sort of get better or you die. Hopefully, you're better because you got homeopathy. But the chronic diseases are the things, the allergies, the chronic repetitive ear infections, which actually are more ear inflammations, the feline lower urinary tract disease, cystitis cases, chronic arthritis, intervertebral disc disease, all the immune-mediated conditions, masticatory myositis. In my world, big ones of inflammatory bowel disease, malabsorption disorders, asthma, cancer is really also a chronic disease. These cases require a different approach, but we can approach these conditions with hope in homeopathy. We're taught that these things are incurable, but in many cases, we can restore patients with these conditions to health. And when you're doing so, you're not chasing the side effects or creating new troubles from the drugs as you would with allopathic medicine. And indeed, there are some truly incurable patients. Patients may come to us with disease so advanced, especially some cancer patients, where they may be incurable, but with proper prescribing and an understanding of how to do so, you can give these patients a quality of life that is unsurpassed with any other form of medicine. And that's a real gift, a real gift. Next. And in the program, we spend a great deal of time, discussing the remedies that are indicated for chronic disease, because there are remedies. All the remedies that Sarah mentioned, or almost all of the remedies Sarah mentioned in the acute, those are wonderful remedies that have extremely important actions, but most of those remedies do not have the power to reach down to the most fundamental levels to cure chronic disease. Not all remedies are the same, and it is important to have a good understanding of that. And also to develop case strategies for the variety of chronic cases, because chronic cases may present to you at different stages in their development, or perhaps having been changed and suppressed by years of conventional treatment. Unless your practice is sort of well established and your clients have been coming to you for a while, it is often the case that homeopathy is the therapy people seek as a last resort for a chronic problem rather than a first thing. And one has to have an understanding of how to work with these patients. Even patients who are on conventional medication, there are particular ways that those cases can be handled moving into homeopathic care. And so we take a really strong approach in giving you an advanced study of case analysis, really in-depth case analysis, prescription, and response evaluation. We do a lot of casework. We expect students to work through cases. The program is long enough that we're going to have time to follow cases over time. And all this is really, really important to give you that grounding and reinforce your understanding of how homeopathy uses the sort of totality of symptoms, the patterns of the patient throughout their life, to identify and treat the imbalance in the vital force that we call chronic disease.
So the reason why Andre and I are really harping on this difference between acute and chronic disease is because understanding the different remedies to use and the different approach, what that means is you will either have success or not successful prescribing. And that's so important because I've traveled over the world, and I said at the beginning of the discussion that I live in the UK. And so I've worked with other programs and worked with graduates from other programs, and that if the teaching program does not help you understand the difference between acute and chronic disease and the remedies to use, you won't be successful in practice. And so that's really important for you to understand that when seeking out homeopathic training, you want classical homeopathic training based in the art and science of homeopathy. And that will guarantee you the most successful prescribing that you'll see in the case examples to follow. So we introduce chronic disease and PIVH modules 2, and then we'll continue to build on the complexity of cases throughout module 3, 4, and 5. While we have introduced acute disease prescribing in modules 1 and 2, we will continue with the level of severity in acute cases. We start with simple wounds and injuries, cystitis, gastroenteritis, and then we'll build throughout the course to more life-threatening critical acute scenarios and teach you how to deal with it as your skill level evolves throughout the program. So in chronic disease, we teach you how to learn to recognize all the symptoms in a patient as an expression of chronic disease and how you approach that in your history taking. And then your remedy selection based on when you get that big pile of history, how do you select the most characteristic symptoms of that patient that will lead you to the curative remedy. So when you look at all the symptoms of the patient's lifetime, how do you see with your laser-like focus what are the most important symptoms of that patient? So, for example, a patient with a history of ear discharges, cystitis, vomiting, a ruptured cranial cruciate ligament, all in one patient's history, will receive one homeopathic remedy to address its susceptibility to all of those problems. We'll also teach you to learn to optimize essential computer software and different reference material to really streamline and guide your case analysis and prescription selection, because we don't have the time that our historical colleagues had in the 1800s. We all live in very busy practice scenarios these days. We see a high volume of patients per day. So there are tools to help you with your case analysis, and I'll show you as we go through our case examples in a few minutes. And it's just really important to emphasize that because homeopathy is a profoundly rewarding modality to practice, and it can be quite efficient in your practice model. So, Andrea, would you like to carry
Yeah,
on?
so right. So in summary, regarding chronic disease, just as in acute, effective homeopathic prescribing can restore health with a single remedy to treat multiple symptoms. In our chronic patients, it is often the case that it may be a series of single medicines that are part of their journey back to health, because sometimes it's difficult to identify the exact one remedy that moves the patient there because the patient has been changed or shaped by other conventional treatment. But again, it's always one remedy at a time, assessing the patient's response. And there are rules that we will teach you about understanding is a remedy eliciting a curative response or a non-curative response in a patient to help you move that patient along. And as we move the patient to health, towards health, we will see improved well-being, improved general health, and a decreased susceptibility to future illness for the successfully treated patient. It's a wonderful thing.
And that's a really big difference with homeopathy comparing it to allopathic medicine, is that when we cure our patients, we truly expect them to move on to a higher plane of health. We don't just expect that single problem resolved. We expect them to be more resistant to acute infections. We expect them to not go on and develop deeper problems. And it's an entire different way of viewing health. And you'll find it very satisfying when your patients, where you start seeing patients with average life expectancies exceed your colleagues' expectations. So in my practice, I expect all my Labradors to get to 16 or 18 years of age, which is very different than in allopathic medicine. Andrea, do you have anything to add to that?
Yeah, I think that if one has the ability, especially to start working with young animals and go forward, it is remarkable. Um, I would just say that my clients who I'm on sort of the second generation of patients that I'm now working with younger animals, all my clients say to me, "Gee, I never knew that cats didn't vomit." It's just an amazing thing. Just it's a completely different situation to have an animal be in a state of health that I never really saw when I was in conventional practice.
Mhm.
And so this is our last little pitch point. So why add homeopathy to your practice? There is the simplicity of the prescription of one homeopathic medicine per patient at a time. Especially in my cat world, my clients so appreciate that they're given one little dose of a tasteless sugar pellet versus 5 vials of pills to take home. Everybody loves pilling cats. Um, we are promoting healing. We are promoting healing at the most fundamental level instead of suppressing symptoms of illness. We have no undesirable drug-like side effects. I don't have to worry, like my patients who used to be on prednisolone, I would then worry they'd become diabetic. That doesn't happen with a homeopathic remedy. There is a rapid return of a patient's well-being, and this can be even in the case of problems that are not fully curable. The patient can still feel so much better in and of themselves. The remedies are inexpensive to stock and prescribe and are applicable to all species. So one homeopathic pharmacy fits all, from the fish to the people.
All right, everyone, time to begin our exciting case presentations. So, Andrea's given you a little taster of homeopathic theory to sort of lay the ground and the foundations for you. And so now we're going to go through individual cases to briefly demonstrate and explain how do we view a case from a homeopathic perspective? How do we select the most characteristic symptoms? A brief example of what case analysis looks like, prescription selection, dosage, including showing you frequency and potency, and then, of course, follow-up monitoring. So our first case is an example of a European collared dove, a near drowning episode. So quite a dramatic little wildlife emergency. So this was in July 14th, 2022. This was a dove fledgling in the first 48 hours of learning to fly out of her nest into our stables. So we were in the process of building a large barn. This was on my property, and these were temporary wooden stables that we had set up. So as you can see in these two photos, this is our wooden stables, and you can see our beautiful colored dove fledgling. And because I was in and out of these stables all day long, every day, I was able to see the pair nesting, hear them as they were growing up. And I was quite excited on this day because this was their first day of fledging and learning how to fly. And they were flying back and forth and landing on these stable ledges, as you can see here, for a rest. And as we all know with fledglings, when they learn to fly, they tend to take off and then have these very dramatic crash landings as they still don't know how to use their wings and legs properly. So they were flying back and forth in the stables and crashing into the ledging and then having to rest before taking off and trying again. So I found this little dove fledgling just after midnight, stuck in a water trough in the barn, presumably bounced off into it after a bad landing. So I hadn't been in the stables for a number of hours prior, probably about 6 p.m. And as you can see here, the stable ledging is right next to, it runs all the way around the stable, but here's the water trough. So you can see it's not a very long drop if she has a bad landing. So when I found her, she was just about keeping her head above water and she was on the verge of giving up. So she had her wings fully outstretched to stay afloat. Her whole body was soaked right through, and she just had no more strength left and she was unable to move. So I immediately scooped her up out of the water, and she was so weak and shivering and hypothermic, and obviously I had no idea how long she had been there. So I bundled her under my coat and I rushed inside the house and I wrapped her soaked little body in a birdie towel burrito as I rushed to my emergency kit. So I quickly, due to my emergency knowledge of keynote prescribing, grabbed a dose of aconite 10 m. So that's a very high potency, higher than what you'll see in over-the-counter pharmacies. I dissolved it in water and gave it by syringe. So I just put a few drops along her beak that kind of seeped into the corner of her mouth and along her nair. In the meantime, for supportive care, I started warming a hot water bottle and then I changed her towel so that she could mean a fresh, dry towel to try to warm her up as fast as possible. So the response I observed, I could instantly see her visibly reacting within seconds post aconite. And that's not an uncommon response in an emergency. She stopped shivering before the hot water bottle was applied. So I let her settle. She's so weak. And of course, from dealing with any of you who have wildlife training, is that they're so sensitive to these scary humans handling them that you have to be very careful with a shocky bird because they can instantly go into cardiac arrest. And she just seemed at that point so grateful to be wrapped up and warm and not be fighting for her life anymore. And I was checking her body temperature by sticking my finger underneath her wing, and I could feel that her body temperature was slowly rising, but she was not reacting to my body temperature checks, which, she's a wild bird. She really should have been. So here she is within 5 minutes post aconite 10 m. So you can see she's relaxed within herself, she's closed her eyes, and she's just taking a moment to rest and recover. So why did I give aconite, might you ask? Aconite is a very prominent acute remedy that you'll learn to use well. It's indicated for sudden, violent acute illnesses, and it has keynotes of causation from shock or fright. It also has the causation of taking cold, so aggravated from taking cold. And in her case, she absolutely was experiencing hypothermia from being in the water for so long and in physical and emotional shock from trying to fight for her life. So aconite was a well-selected remedy. So as I continued to monitor her, she was definitely gaining a bit of life back, but she was still so weak and cold and she wasn't properly reacting to my temperature checks. As I said before, I was expecting her, as she recuperated her strength and came out of the shocky state, she should have been reacting to me being near her or handling her. So after about 30 minutes, now with wild birds, you try to take a minimalist approach. So we call it the hands-off approach because, again, you don't want to push them over the edge because they're not used to being handled or being near humans. So I repeated the aconite 10 m after about 30 minutes, and she brightened up within 5 to 10 minutes. And she actually started reacting to me checking her by starting to peck my finger and say, "Step off." And so I left her to snooze because I was really pleased that we were returning to more normal homeostatic response. So as you can see in this photo, this was a photo of her within 5 to 10 minutes post second aconite dose. And you see her eyes open. She's giving me the hard bird stare, and she's definitely more alert and reactive. So she continued to improve, and I placed her in a bird-friendly cat carrier with a refreshed hot water bottle and a towel wrap overnight with amenities to recoup. So as you can see here, she initially was so weak and exhausted, I just had her wrapped in a towel on my chair in my kitchen. And then here she is post 2 doses of aconite and all wrapped up and settled for the night. So 5 hours later, so at this point, it was now 4 a.m. So I left her at 4 a.m. to go sleep for a few hours. And at 9 a.m., I checked on her. And that's this photo over here on the right. So excuse the reflection with the cat carrier, but you can see she's bright as a button and she is ready to return to her world. You can see that she still has quite a bit of preening to do to get her tail's feathers sorted, but she's definitely recovered from her shocky event. So I gave her a little bit of time, and then I released her safely back into the stables right where she was nesting at about midday, 13:18 that day. So I observed her resting for a few hours up on the top beam of the stables. And then she started testing her flights between the top beams of the stables. And about 3 hours later, she was fully recovered and rejoined her parents, and we observed her crop feeding. So I knew she was going to be okay. Because obviously she was nesting in stables I was in and out of multiple times a day, I was able to observe her fully mature and fully fledged and make a full recovery. So this is just a nice example case of in emergency medicine, you can use your textbook keynote knowledge to prescribe immediately to stabilize a patient. And again, this is a wild bird, so I didn't need to look for a different medication that would be safe in this species because it's one remedy can treat all species. So, moving on to our second case example. So, you saw a historical case of colic. So, now here's a case of colic from my veterinary practice. This was May 27th, 2014. Penny is a 25-year-old Shetland mare, and she had no previous history of colic. And her owner was a very experienced horse owner, and she just had a momentarily lapse of judgment. She couldn't explain why she did it later, but she decided that day to just go ahead and turn her senior Shetland out on a new grass field full of lush grass and left her out in it for the whole day and brought her in that evening, not surprisingly, showing signs of colic. She had bloating in her caudal abdomen. She was not passing manure. She was refusing to eat, and she was acting painful. So the client called out the closest emergency practice because she was a bit of a panicker, and I lived about an hour away from her. And the emergency vet diagnosed a gas colic and administered an IV injection of Banamine, which is flunixin metaglamine for non-large animal vets, at 7:45 p.m. So that was at 7:45 p.m. It's now 9 p.m. She's not showing any signs of improvement. She's still painful. She won't eat. And now the client's decided to call me. So at this point, due to the rules with the Royal College of Veterinary Surgeons in England, because she had already engaged care from another veterinary surgeon, I needed to let their treatment plan sort of fall through. So I instructed her she needed to wait 2 hours for the full onset of action of Banamine unless Penny had showed any signs of worsening. She must contact me immediately, and I stressed this to her highly. So the client phoned me at 9:45 p.m. on the dot, reporting no change, and she was just desperate to ask me to prescribe a remedy. So at this point, I was still out on calls, and unfortunately, I was still quite a distance from this client's house. So I took the case over the phone, and her symptoms at that time, she still had a distended caudal abdomen. Her abdomen was very painful upon being touched. Now, Penny was trying to bite her owner, which was highly unusual because this is a very, very sweet Shetland mare. She's the kind of mare that would rather flee a situation rather than to have to defend herself. So the fact that she was actually lashing out and trying to bite was just absolutely not characteristic of her personality. The client also observed her to be burping 3 times in the last 2.5 hours. Now, I was deeply concerned about this symptom, and she had unfortunately not told me this earlier. So, for your non-equine vets, horses should never burp. They are not designed to burp. And if a colicky horse is burping, you are deeply concerned about an obstruction. And at this point, she had not passed any manure. So I start to get very concerned because I have a burping, colicking horse, and I'm starting to reroute myself to this client's farm. In the meantime, I pulled over and I did a very quick homeopathic analysis. And this is an image from a homeopathic software program called Radar. And I'm just going to give you a brief description of what doing a computer homeopathic case analysis looks like. So over on the left, you'll see a list of symptoms. So these are what we call rubrics. Remember, I discussed before, a repertory is a book full of lists of symptoms and correlating remedies. So for every symptom and its correlating remedies, we call that a rubric. So the characteristic symptoms that I isolated for Penny were abdomen colic. So we have a colicky horse. That she was burping. The historical term for burping is eructations. We had a inflated or distended abdomen, so I knew we were having distensive pain. And most importantly, she was aggravated by touch, but not specifically touch anywhere on her, touching her abdomen only. So with each symptom, you can see, for example, abdomen colic, you'll see this number 104. That means there's 104 remedies in that rubric for colic. So that means there's 104 remedies that are highly indicated for the symptoms of colic. And those remedies are organized for that symptom by intensity or grade that they have to curing that symptom. And what the computer program does for you is it then takes the symptoms you've selected and then it gives you a numerical analysis showing you a list of remedies that come up in the highest grades for the symptoms you selected, essentially giving you a differential diagnosis of remedies for you to study. So I always tell our students, remember, a computer is not a brain. It's simply a tool. It can only give you an analysis of show you remedies to study based on the symptoms you've selected. So a key part of your training is learning to identify what are the most characteristic symptoms and how to find those in the repertory. So this brought up a group of remedies: belladonna, china, calicarb, aconite, arsenicum, ipecac. And again, you don't necessarily select the remedy that comes out number one in your analysis. You need to go read about the remedy in the Materia Medica and study it and see of all those remedies which fits your patients the best. So I knew from all of my training that belladonna is a remedy that's highly noted for aggravation from touch. Penny was trying to bite when her abdomen was being touched. And as I said before, that was a strong keynote in this case because this is an extreme change from her normal, very sweet disposition. Belladonna is also a preeminent gas colic remedy. It's got loads of gas colic symptoms, and it's also noted for conditions that come on very intensely. So I selected Belladonna 1M, which fortunately I knew this client had in her emergency kit. So as I was speaking to her on the side of the road, as I pulled over to do that case analysis, she gave a single dose of Belladonna 10M at 10 p.m. and I continued my drive to her farm. So the response, Penny began to relax within the first 5 minutes of the remedy. I told the client to continue to monitor. At this point, I'm staying on the phone with her. Within 15 minutes post remedy, she passed a pile of manure and started eating. So for non-horse people, this indicated that her GI tract had started moving by her passing a pile of manure. And with the fact that she started eating was a major well-being sign for me because a happy horse is an eating horse. Her abdomen gradually looked less bloated over the next 2 hours. And I told her to continue to monitor, and we had certain stage checks where she reported back to me. And she just continued to improve and return to normal, so no further medication was needed. So this is a lovely little case example, just like that historical case, showing you how one dose in an emergency situation was able to right the patient within minutes and bring them back to a state of health. And what I want to share with all my equine colleagues in the room is this is how I expect all of my colleagues to respond. And that's such a rewarding way to practice because so often I'm never actually attending the farm call because when you see a response this fast, most of my clients live at least an hour away from me. So I can't get there that quickly. Again, stressing the value of having emergency kits at home. Andrea, did you have anything to add? I saw you do the lean in.
Oh, no, I mean, your track record with colic. Tell them your track record with colic.
Um, Elucidate further.
Well, you fix them all. I mean, they don't need surgery. They don't need to have
Yeah.
tubes passed. They just don't need anything other than the right remedy. And
Yes, 100% of my colic cases don't have NG tubes pass. They resolve quickly. I don't need to refer them
yeah,
on. And it's about catching your patients quick enough. All of my clients are very good clients. They don't sit on things. They don't sit on things all day. And so it's just such a rewarding way to practice to what I experienced before.
that's a tremendous amount of suffering to relieve because a colicking horse is a really suffering creature.
So our next case, delving into Andrea's field of feline practice, is a feline eye case of a ruptured globe. This is a case from Sharon Forrester Boulin. She is a veterinarian in Corvallis, Oregon, and she took the professional course in veterinary homeopathy in 2017 and 2018. Sharon, in all her free time from running her own practice, does community outreach service. She's a volunteer vet. And she, on this day, received an ophthalmological consult request via text that was very dire. And in Sharon's words, she said, one of our homeless community had brought in her intact male cat named Stormy Weather, who had an eye problem of a long duration. And she couldn't elucidate further actually how long this had been going on. And on exam, she could see very apparently that it was a severe ruptured globe. In this limited situation about what tools she could provide and what kind of recheck she could offer, she decided to proceed with homeopathy. And she recalled from the PIVH Module 1 course notes that symphytum is the arnica of the eye. So now we briefly mentioned arnica being one of the most prominent remedies for trauma and injury and pain. Well, symphytum, and many of you know symphytum from your herbal studies, has a similar correlation to trauma and injury and pain for the organ of the eye, hence being called the arnica of the eye. So she prescribed for Stormy Weather a single dose of symphytum 1M and administered there. So after administering the remedy, Sharon said that he then ran away to court females, being the intact male. She saw him again about 10 days later in his cage, arriving on the back of her bike. It was a remarkable recovery. All right, so hold on to the seat of your pants. So we're now going to show you what the eye actually looked like. So here's Stormy Weather before treatment with his ruptured globe. So you can see there's a nice incision down the center of his cornea and, with severe, severe chemosis, inflamed conjunctiva for the non-veterinarians in the room. Andrea, do you have any comments before I move on to post-treatment?
That's just an eye that would scare most veterinarians. I think we'd agree.
And here, 10 days after treatment with a single dose of symphytum 1M. Now, this is the same cat. As you can see, you can still see the injury marks above the eye. This cornea has completely healed. While there is some still corneal scarring and remodeling, that is now an intact healed globe. This case is so profound because this exceeds our expectations of what we were taught in veterinary school. Most of us would have expected, at best, we would have calmed the inflammation and the pain down on that ruptured globe to schedule an enucleation of that eye. Hand on heart, I don't think many people would have expected within 10 days, with one remedy, would see this miraculous healing response. And this is why I love homeopathy, because every case is different. And year on year in practice, I never lose the enthusiasm for seeing such miraculous results.
Sarah, we did have just a quick question in the chat that said, was there any other treatment involved? And I clarified, no. If we are ever presenting a case to you here in this seminar, anything in the course, we will never, the case will always be presented as one that is just homeopathy, or if anything else was done because the client diverted to something else, we would let you know if that was the case. But this was simply one dose of remedy.
All right, so our next case, we're dipping back into the equine field to give a nice demonstration of dealing with infectious disease. So this is Marmite, a case of equine strangles. This was August 4th in 2012. Marmite at that time was a 2-year-old filly. She was a standard bred cross French trotter. She was currently residing at a horse breeding dealing facility that had a high turnover, which had strangles, which is S. equi, endemic on the property with recurrent outbreaks. So on physical exam, I found that she had acute submandibular lymph node swelling, quite dramatically worse on the left. And there was soft tissue swelling underneath that left mandible that was so severe, it traveled all the way up over the left cheek and throat latch region. And to this day, I think that was the most severe muscular involvement swelling case I've ever seen for strangles. She also was showing lethargy, malaise, and a decreased appetite, quite common symptoms for strangles. And given the fact that strangles was endemic on the property, the client declined further diagnostics and just wanted to proceed with treatment. So I selected a remedy called Calcarea carbonica 10M and gave a single dose to Marmite. Now, I selected Calcarea for its affinity for glandular swelling below the jaw and neck, abscesses deep in the muscles. Remember, this had very deep muscular involvement going up the cheek, and painful swelling and separation of the submandibular glands. Now, how much does, like strangles, does that sound? And here's her response. So within 24 hours of the remedy, we see that change in well-being. We see her becoming much brighter in herself. She had a returned interest in feed. The swelling, that dramatic swelling, had reduced around the cheek and the throat latch region. You could start to see all the distinctive anatomical markings. And then within 48 hours, that abscess ruptured. The swelling dramatically reduced further to more concentrated to just around the affected lymph node. And she had a complete return of normal behavior. And let me orient you on this photo. So this photo over here on the right is showing you that left submandibular affected lymph node that had ruptured. So we're looking underneath the jaw up into that lymph node on the left side. So this is that lymph node post-rupturing. And her response just beautifully continued. That draining abscess and all swelling resolved between 4 to 7 days post-remedy, and no further treatment was needed. Now, for any of you in the room used to treating strangles, you can see how fast that response was. The fact that she had that return of well-being and interest in feed, and then complete return to normal behavior within 24 to 48 hours. That's quite profound. And then total resolution within the week. And here's a photo of Marmite on recovery, and you can see she is a very lanky, growing 2-year-old, but very much looking very well post-homeopathic treatment. So our last case we're going to discuss in this presentation is a case of chronic disease. This is a case of Taz for behavior treatment and a malocclusion issue. So Taz was a 4-year-old neutered male border collie. He was from a working line, and I stress from a working line because living in England, border collies are highly sought after working dogs, and because they are highly selected for their working traits with sheep, that you can see more behavior atypathies in these working lines. So his presenting complaints was problematic behavior. He was fearful, anxious, noise sensitive, fear aggressive. It goes on. We'll go into that further in a later slide. And he had only one other physical symptom. So we had the behavior issue, and then a patient that it was just fairly well his whole life. No history of any kind of puppy illnesses, ear infection, no GI issues, all your typical dog symptoms you run through. He'd always been a well dog with an extreme behavior problem and this malocclusion. So on physical exam, he had an overbite that was a class 2 malocclusion, mandibular disocclusion. And it was such a significant overbite or overshot jaw that when you lifted his head, it was like a shark-like appearance under his jaw. And his mandible was displaced caudally by greater than 2 centimeters. And as I said before, because he was so anxious, it was difficult to measure because he was so nervous. And in this photo, you can see that 100% of the time his tongue was protruding from his mouth in varying degrees. So a little bit more about his behavior. So he was first observed to have abnormal behavior traits at 4 to 5 weeks of age by the breeder. Now, that's a big red flag to everyone in this room because that's a key developmental time period. So already we're thinking he is not developing normally. And despite extensive training and behavior modification, his symptoms were little modified by 4 years of age. Now, dogs at that time period at 4 to 5 weeks of age, they're going through a developmental stage where they are learning what is safe and unsafe in the world. So if they hear a loud noise and nothing bad happens, say a door slamming, they learn that that noise is not something they should be afraid of. But Taz, with all his behavioral issues, he wasn't proceeding forward through that developmental phase where he was actually learning what he should or should not be afraid of in the world. And so he was stuck in that delayed developmental phase. And I see a lot of noise sensitive dogs. And when you discuss with advanced behaviorists, this is a theory that they're really stuck in that delayed developmental age time frame. So Taz was wary of people. He was fear aggressive with strangers approaching on the street, entering the home. He can run and hide from strangers. Again, never acclimating to learn what's safe, what's not safe. He was hypersensitive, hyperreacted. When he was stressed, he would urinate when he was stroked, so you can see the level of fear and anxiety. He panics with raised voices or any kind of shouting. He had displacement activity. So when he was stressed, he would be observed chewing the fronts of his legs, his antebrachium, and that could be quite crusted and stained. And unusually, he was never interested in playing with other dogs, either new dogs or his other 3 housemates, which is highly unusual, especially for a border collie. And these clients ended up with Taz because they were highly trained working dog owners. They did competitions, they did loads of training courses, and so the breeder felt Taz was a safe dog in their home. But Taz absolutely exceeded any of their experience and tools, hence I was called in. So here's another example of a homeopathic case analysis. Now, there's many different ways I could have worked up Taz's case for those of you that already have had homeopathic training in the room. But coming back to that key factor of these symptoms showed up at such an early age, you can see he wasn't developing normally. He wasn't acclimating and learning how he should have been. So one of the main symptoms of my case was this delayed development. And so in the analysis, the first analysis I'm showing you here, I'm using a rubric for development, growth affected, dwarfishness. Now, the word dwarfishness is not referring to someone being a small person. It's referring to any kind of delayed development in the older medical literature. I also used a rubric that's quite a nice rubric for fearsome, anxiety, dread, frightened easily, etc. And in this first analysis, just simply looking at these 2 most characteristic symptoms, I get Burrita carbonica, calcarea, phosphorus, sulfur, natrium muriaticum, etc. And so remember, this is a differential list of remedies for me to study. Now, in a second analysis, using a different repertory, again, using a rubric to represent the delayed development, a rubric to represent the mind starting or startled easily, mind sensitive, oversensitive, right? Because we have this oversensitive patient, reactive patient, and just a simple rubric to represent the level of fear. And so as you can see, using a different repertory, different symptoms, I'm getting similar remedies, So here I get sulfur, burita carbonica, calcarea, lycopodium, carbo-veg, silica, zinc, etc. And nature muriaticum drops further down. So again, these are differential lists of remedies to study. And as you can see, depending on what symptoms you select, will change what remedies come up in your analysis and what order they come into. So this is where your training as a homeopath kicks in, so you know how to study them in review. So let's see what I prescribe for Taz. So on January 30th, 2014, I prescribed Burita Carbonica 1M in a single dose because this is chronic disease. I'm giving him a single dose and seeing what happens with his response. And the reason why I selected Burita Carbonica is it has striking symptoms in the developmental sphere. So lack of mental or physical development from a very early age, a frozen maturation process. It has lots of fear symptoms, such as fear and hiding behavior. They're easily frightened and afraid of strangers. They can be cowardly and have sudden ebullitions of anger, but coupled with cowardice. I love that phrase because that perfectly describes fear aggression in dogs. Now, not all fear aggressive dogs will be Burita carbonica, but it is definitely a remedy to consider. It also has extreme oversensitiveness of all senses and an oversensitive to noise and voices. So, again, a great remedy to have on a differential list for noise sensitive patients. And then it has that highly unusual symptom of the child that does not want to play. So, I felt like Burita carbonica was a great fit. Let's see how Taz responded. So I'm going to go over his remedy response in two sections. First, let's talk about his physical symptoms. So remember, we only had one symptom, and that was the malocclusion. And at 4 years of age, I and the clients had zero expectations of that to change. I was just noting that to make sure I could help flesh out my remedy picture better to prescribe the most accurate remedy, because the remedy would have to have that symptom in it. So the clients observed Taz doing this. He was scratching across the bridge of his muzzle, and he had excessive drooling, and he was eating slowly for several weeks post remedy. And then again, he went through another phase of this scratching across the bridge of his muzzle after 3 months. And on my rechecks, I noticed that at 2.5 months post remedy, there was only a very slight overbite remaining. And at 4.5 months post remedy, that overbite resolved or completely corrected. Now, to remind you again, Taz is 4 years old. So for non-dog vets, in dogs, his growth plates should theoretically have been fused by several years. So this is technically impossible according to my veterinary school training. So going on to discuss his behavior, within the first few weeks, we saw this general increased confidence with people, raised voices. His response continued to develop. He was playing with other dogs. He was so confident, they actually were having hierarchy issues in the pack because Chaz was now challenging the other dogs above him because he felt like he should now be in charge. He started coping with the world and he was excelling in training. And at 6 months post remedy, he was considered the best behaved dog in a home of working dogs of other collies and English spaniels. So this case stands out in my mind to this day of the power of homeopathy with just a single dose of a remedy to truly unlock someone's potential, unlocking the genetic code and allowing Taz to be the healthy individual he was meant to be. He did have one more dose of Brita carbonica later that year in November. So now we've gone from, oops, sorry, here we go. From January to November. So we repeated the Brita carbonica in a 10M because he had a minor increase at that time in hyperactivity and wariness of people. He responded again, improving gradually over several weeks with general increased confidence. He was more relaxed with people, etc. They were taking him on the bus. By the way, these clients had been taking this fear aggressive dog on the bus this entire time. And so now they were telling me, oh, yeah, he's great on the bus now and he'll greet everyone. And I was horrified thinking of the legal liability that I didn't know about beforehand. So at this point, both I and the owners classified his behaviors as within normal limits for any working border collie. And there's Taz, the beautiful, handsome man that he is. So, I hope these cases gave you a very nice introductory examples of homeopathy in action. So, in summary, you saw how we match a remedy to the patient's complete symptom picture. And remember, as Andrea taught you, the remedy must be able to create the same symptoms of illness in healthy patients as the sick patients. And so, our fundamental rule of homeopathy of like cures like, a similar remedy will allow the vital force to cure the patient. So, we observe a healing response, a rebalance, and swift return of well being, and a return to optimal health, and truly see the ability to cure our patients in the highest sense. And these cases are not exceptional cases in my practice. And I want to really reinforce that with you. While they are nice, beautiful teaching cases, these are the results I see every day in my job. And this is why I love homeopathy so much, because it truly gives you the ability to cure and help your patients achieve their genetic potential. So, if you are inspired and homeopathy has grabbed you, perhaps you've been studying homeopathy already, but you want to learn more, we would encourage you to take the Professional Master Course in Veterinary Homeopathy. So, as I said at the start of our lecture, the PIVH has been teaching veterinarians classical homeopathy since 1992, founded by the pioneer of veterinary homeopathic education, Dr. Richard Picarin. So we have unified our prior beginner and advanced courses to offer you one complete master course. So this is over 250 hours of live faculty instruction offered over 18 months. Because, as Andrea was stressing to you before, learning the difference between acute and chronic prescribing and then working with your chronic patients over months, like you saw with Taz, working with him over that whole year, we need to give you the mentorship that you need with your own cases over that course time period for you to become confident prescribers. And so that's why our course is designed at the length that it's at. Our faculty team bring decades of experience with classical homeopathy as their primary modality in both small and large animal medicine. We have a combined faculty and mentor team that can provide over 265 years of clinical experience. We're now fully online, so we offer you a multimedia program of live learning modules as you move through the main course material. We then have intermodular webinars to keep you in touch in between the live modules, and case rounds, as well as an online student forum for you to post and get help. And of course, we always have mentors available to talk to you on the phone when needed. So it's a wonderful, complete, supportive program to really help you master the art of classical homeopathy. So our next course begins later this summer. And if you have any questions about our program, obviously we can also ask your questions about theory, etc., at the end of our webinar. So before we leave you, we definitely would like to give you some recommended reading that you can start with now. And just to let you know, all of these books are on our recommended book list. So the first sort of step is your introductory reading. So depending on where you're at in your homeopathic journey. A nice, lovely, simplistic book is The Practical Handbook of Veterinary Homeopathy by Wendy Jensen. So Wendy is actually the homework administrator in the homeopathy course. And she was one of the first graduates of the PIVH program back in 1993. And Wendy also helped Richard Picarin write the New World Veterinary Repertory that's now available in book form and on all the major homeopathic software such as Radar, Synergy, Complete Dynamics, etc. So the Practical Handbook of Veterinary Homeopathy is actually written for clients, but it goes through lovely case examples to really show you what you can expect of homeopathy in basic theory and practice. Then we also have Homeopathic Care for Cats and Dogs, Small Doses for Small Animals by Dr. Don Hamilton. Don Hamilton is another early graduate of the PIVH program. And this book is, I like to describe it, it's a nice little introduction on keynote prescribing. So it's not going to give you the advanced theory that you would get in something like our program, but it's a really nice reference material for keynote prescribing as you're starting to learn your basic remedies in acute casework. And it's very handy for the lay prescriber. We also have Dr. Picarin's Complete Guide to Natural Health for Dogs and Cats. This was written by Richard Picarin and his wife Susan Picarin. And this book is it's a book to give you a general guide on natural health care, but the main focus is nutrition and homeopathy. So it's a nice reference source for any holistic vet and clients. Another good book that's not a veterinary book is The Magic of the Minimum Dose by Dorothy Shepherd. Now, Dorothy Shepherd was an amazing homeopath, and she has a wonderful way of using simplistic language to explain homeopathy in casework. And she lived in practice from the time period, her practice life stretched from World War I all the way through the mid 20th century. So she has a really nice sort of arc of practice time closer to our modern day. And she's got lovely case reports in that book, and it's a very entertaining, easy read. I'd love to take Dorothy for a cup of tea. If you're looking for some more advanced reading, one of the books that's on our pre-reading list for the course is The Science of Homeopathy by George Vithoulkas. This is an excellent book. It's definitely not an introductory read, but it gives you a very good grounding in the science and theory of homeopathy. And it's one of those books that you can read multiple times over throughout your homeopathic career and get more and more out of it. Now, a more advanced book is the foundation book of all our homeopathic theory and principles, which is the Organon of Medical Art. This was Samuel Hahnemann's, the founder of homeopathy. This was his master work. And so this is a book I wouldn't really recommend you start reading until you're actually within the homeopathic program because of the historical language. You'll find it quite confusing, but it is a good book. It is a book you need to have to actually study homeopathy. And then, of course, we have loads more reading suggestions if you actually go to our book list. So if you go to our website, go under the course and master course, and then just go down to the book list, and we have loads of different books that might pique your interest. So websites to go to for good resources, obviously our PIVH website, pivh.org, and then that's our contact email that you can reach me, the director. And then also the National Center for Homeopathy has loads of great information, and that's homeopathycenter.org. There are so many other homeopathic websites out there, but these are just two good ones to go ahead and start with. So this brings us to the conclusion of our presentation. Thank you so much for giving us your time and attention tonight. And I hope this gave you a little bit of grounding in the basic theory of homeopathy, piqued your interest, and inspired you to start your homeopathic journey if you're not on one already.